You have now entered the Pretty Tough. Welcome to the Pretty Tough Room podcast. I'm your host, Sadell P. And today I'm here with independent mental health consultant and advocate, Anita Fisher. She's going to close out our month of mental health awareness by answering a few questions about mental health, mental illness, stigmas, and services available, and a lot more. Anita, welcome to the Pretty Tough Room podcast. Thank you for taking the time to meet with me and sharing your knowledge on this very important subject.
Well, hi, Sadell. Thank you so much for having me. I mean, this is a big part of what I do is I love sharing our experiences, with everyone because that also helps to erase the stigma of mental illness.
I agree. Thank you, and you're welcome. So, Anita, please tell us who you are and about your experience and your knowledge in the mental health field.
Well, it started actually as a personal journey. About 20 years ago, my oldest son was diagnosed with a serious mental illness. And of course, we knew nothing about mental illness. And it took actually several years for us to really understand it because some of the things that we noticed in the beginning, it was drug use, so it was self medicating with drugs and alcohol. And we thought that was a primary issue. But actually, it was a clinician that eventually diagnosed that he did have a mental illness diagnosis. And from there, we went on to educate ourselves because the key word in that is illness. And like with any other illness, there is treatment available. We supported him as a family, and eventually that grew into a passion to work with and serve other families because I didn't want them to be lost for 3 years like I was in finding resources and support. And I actually found an organization called NAMI that was so helpful to us, NAMI San Diego. And they first said, hey, take this free 12-week class. I said, 12-week class? I'm in crisis right now. I don't have time for a class.
That's right.
But my husband and I took that class, and it was life changing because it was a family education course, free, still offered today. As a matter of fact, I also teach that class today. And then many more things, but we'll get into that a little later. But that's actually how I entered in this field, and that's why I say I am a family advocate. It has now been 14 years
Wow.
since I left my career in banking, and I devoted myself 100% to mental health.
Okay. If you don't mind, may I ask the mental illness that your son was diagnosed with? What was that?
He was diagnosed with schizophrenia.
Okay.
And that took many forms because some people don't actually realize that mental illness diagnosis is one of the many illnesses that they don't do a blood test or a brain scan or something that you typically have when diagnosing someone with some medical condition. So it's usually based on what that individual tells them.
Okay.
It also is very helpful. That's why I encourage families too to share what they see because that will help a doctor to make a accurate and proper diagnosis. But there's been other diagnoses, but that was the one that eventually became the diagnosis.
I have to agree. I think that my experience with mental illness and mental health as a whole, most people find out much later because it's not something that they can test in the blood, or
Hmm.
it is self-reporting, or people need to be mindful of their loved ones or people that they are in contact with to kind of see behavior changes or patterns of certain things like that. So I think it is important, not only to go get regular physicals, but to be honest about some of the things that you may be experiencing for yourself or that you see in other people.
That is, you hit it that nail on the head. And it is stigma sometimes that won't allow people to share, hey, I'm feeling a little different
Mhm.
about something,
Mhm.
or I'm, having some anxiety, or I'm feeling depressed, because they think that there's such a negative a stigma attached to mental
Mhm.
illness that sometimes people won't share that with their physicians.
Yeah, yeah, that's true. So tell me, can you help us all understand what is mental health?
Well, I like to use the description that we use at NAMI.
Okay.
And it says a mental illness is a condition that affects a person's thinking, feeling, or mood.
Okay.
Such conditions may affect someone's ability to relate to others and function each day. Each person will have a different experience, even people with the same diagnosis. But one of the things that is very important to understand about mental illnesses is that recovery is possible. So
Mm,
I always want to share that aspect of it, that with proper treatment and support, and sometimes that includes medication, that there is recovery for people living with mental health challenges.
okay.
And I like to even refer to it. There's something we teach is called recovery language. It's like the person is not schizophrenic. The person is not, bipolar. They live with the condition.
Okay.
We don't call people cancer. We don't call people
That's
AIDS.
good.
We say that a person lives with a particular condition.
Yeah.
And so we also, always want to share that, always keep that hopeful part, that
Yes.
recovery is possible.
Yeah.
And it takes many different types sometimes of medications and mixtures and things, because of the very thing we just talked about, is that there's not a blood test. So you can't say, oh, based on, this blood test or this brain scan, we know it's going to be this exact
Right.
medication
Yeah.
or this
Right.
exact amount. So sometimes it takes several different medications and things to get that person to their place of recovery.
Okay. Like balance. And so sometimes it might be a medication that's prescribed and they have to start either at a low dose or sometimes they start at a high dose just to kind of, because it probably would depend on the person, their body weight and things like that too. So
Everything.
it's trial and error, so to speak,
Oh,
with
yes,
respect to
yes.
medication. Okay. Can you tell us what are some diagnoses of mental illness?
Well, what they consider a mental illness is, in the terms of what we're speaking about, it can include ADHD,
Hmm.
anxiety disorders, bipolar disorder, borderline personality disorder, depression, dissociative disorders, early psychosis and psychosis, eating disorders, obsessive compulsive disorders, post traumatic stress disorder, schizoaffective disorder, schizophrenia. So those are just a few that are included in the major mental illnesses.
I think when I think about mental illness, one of the most common ones I think about is depression.
Yes.
Because that, okay, with respect to like schizophrenia and bipolar, um, those are, like we talked about before, patterns and behaviors, and then that person being mindful and understanding and being honest and open with their physicians. But with depression,
Hmm.
it is a mental health situation. It is a mental
Yes.
illness, but a lot of people don't look at it that way. We use
Hmm.
that term really loosely. I'm
Yes.
depressed. I'm
Yes.
just depressed, but really, it is a mental illness, and it would be conducive to our growth, and as
Mhm.
people to be honest about when we do feel depressed, not just saying it because we have a bad day. Well,
Right.
I'm depressed, because there are people out there who are really dealing with
Yes.
depression in in very significant ways. I know myself last year, I was depressed, and I know
Mhm.
that I went to the doctor, and because I had dealt with something that was really
Traumatic. Yeah.
traumatic. It was trauma.
Yes.
And so with that, I knew, like, I used it loosely, like, I'm just
Mhm.
really depressed right now. That's why I'm not eating, and not
Mhm.
knowing that that is a sign of depression when you don't
Mhm.
eat, when you don't sleep,
Yes.
when you're not doing your regular activities that you do, when
Mhm.
you isolate. And then I went to the doctor, and I just told the doctor, like, this is what happened to me. Since
Mhm.
this has happened, I've lost 10 pounds.
Mhm.
I'm not able to communicate with people. I'm sad all the time. I'm crying. And then he diagnosed me with major depression,
Yes.
and gave me these pills to take.
Mhm.
And I wanted the pills because I didn't want to feel how I felt.
Mhm.
I couldn't help it. But being honest about that, I think, was the first step to
Mhm.
reach out for help and to be honest. But
Yes.
I know that, for especially with African Americans,
Mhm.
we don't like to tell
Talk
people
about
when,
it.
like,
Mhm.
something is off, or not the same with us. And we definitely don't want to go get help for it with therapists and things like that, because it just feels like, people gonna think we
Yeah, we're
crazy
we're
or something
supposed to be,
like that.
the
Yes,
strong
all
black
the
woman,
time.
and the
Yes.
strength, and you can shake it off. And in your discussion, what I've learned in some of the things that we teach in our courses and classes about depression is that, yeah, we all do get depressed,
Mhm.
but it's for short periods of
Mhm.
time. But when it becomes clinical depression like you had, it means that it has gone on for a certain period. It's not going away. Not when you go outside and take a walk. Sometimes I feel depressed and I say, I need to go to one of my favorite spots by the water and take a good long walk.
Mhm.
Well, sometimes that helps me a lot.
Right.
But if that didn't shake it off, or I can't get out the bed, or I really see things like weight loss, some of the things you described,
Mhm.
that's when you should go and see your doctor.
Okay. I wanted to bring that up because I know that I have,
Mhm.
even right now, I
Mhm.
have a lot of friends who are dealing with depression, and I think
Mhm.
that they are comfortable with just feeling like, okay, I'm depressed, but not
Mhm.
understanding that it can get out of hand, and
Right.
it's okay to go and let a
And
professional know, like, I'm
yes.
I'm different than I was before, and can you help me?
Yeah, and I like to give resources, and I know we're going to talk about
Yeah.
that at length later,
Yeah.
but I just want to say that if someone is feeling depressed, they're here in their live here in San Diego County, if they can call the Access and Crisis Line and talk to an actual certified counselor,
Okay.
and that can help them determine if they need to make an appointment. And they're 24/7. So the Access and Crisis Line, and I know we'll give this number, is 888
Mhm.
724 7240, and they're 24/7. So if someone is feeling depressed, they can call that number and speak with a counselor.
That's good, and we'll make
Mhm.
sure that we put that on,
Yes.
our Facebook and
Mhm.
YouTube and Instagram pages so that people can go back and refer to
Yes.
that. Thank you for that. My next question is, what does a person do when a mental health crisis occurs? What is something that a person can do if they are experiencing a
Mhm.
mental health crisis, or someone that they love or care for is
Mhm.
is experiencing a mental health crisis?
Well, if they are in a health plan, they have a health plan. They can find out where the behavioral health services unit is, or walk-in unit, and go. Don't delay. Go as soon as possible. If they have Medicare, the county services, they have walk-in clinics throughout San Diego County, and I know you're going to post those links
Yes.
also, and we'll post the links to where they can find a walk-in clinic.
Okay.
And then sometimes, and this is for family members and loved ones and supporters of an individual who might be struggling, sometimes if they may need to go, you see this might be a crisis situation, there is also calling 911 and
Yeah.
asking for a PERT team,
Okay.
which is a psychiatric emergency response team.
Okay.
And that is comprised of, and you can't just call for the clinician, it does involve calling, there's a law enforcement officer who hopefully has been through the PERT training,
Okay.
and then they come along with the clinician, if that clinician is available. But usually the the PERT trained officers will come, meaning that they have learned some techniques in order to speak with that individual and try to determine and get them to a treatment
Okay,
facility.
okay. That's good information. I know that where I work at, we do utilize the PERT team, and they
Mm-hmm.
actually have a vehicle that, and they wear something that identifies that they are PERT, and
Yes.
it's been really successful with them
Yes.
coming out and kind of assessing
Mm-hmm.
our clients sometimes when we feel like there's a mental health crisis going on. So I thought that that was just for organizations. I didn't know that that was
Yes, they
something that.
come to the home. They
Oh,
will
that's
go
good.
anywhere.
That's really
Yes.
good. That's good
And
information.
I want to just add that it's very important to give that information to the dispatcher when you call 911, that you think the person is experiencing a mental health crisis, and answer as many questions and make the area safe. Turn the lights on outside if it's in the evening or it's in the dark. Make sure that there's nothing around that individual that can be, looked at as being a weapon of any
Okay.
kind. Tell them, say, just sit here. Someone's coming to help you, and then let your loved one know that these people are coming
Right.
not to arrest you. You're not in trouble to
Right.
take you to jail, but they are coming to help get you to some place for treatment.
Okay, and I
Hmm.
should have probably asked this first, but when we say mental health crisis, can we help our listeners
Hmm.
understand what to look for in a mental health crisis? What is something that they can identify that will help them know maybe I should call the PERT team or call
Right.
911?
If that person really, really isn't doing well, they're not functioning well, or, they maybe haven't gotten out of the bed and they
Okay.
are not wanting to go, because that's the crisis when the
Mhm.
person is not voluntarily willing to go
Okay.
themselves for treatment. And when a person gets to a crisis, sometimes just a loved one going and saying, "Hey, I think you need to go in. I'll go with you.
Mhm.
Let me drive you." That is still a crisis, but that person is voluntarily willing to go. The PERT call crisis is the person who may not want to go, but you believe that person, because they're going to do an assessment. That's
Okay.
why the clinician is involved,
Okay,
to
good.
see if it really is a crisis.
But
So
just be rather be
yes,
safe than
then sorry.
sorry. Okay,
Yes.
that's good. That's
Hmm.
real good. Um what do you feel perpetuates the stigma against mental health or mental illness treatments?
Well, even at my age, I'm much older than you. I used to see on TV, quote, the insane asylums, and you saw the people
Yeah,
looking, quote, crazy, a word that I don't use anymore. There
yeah,
are
yeah.
crazy things that happen, but
Yes,
people
not
are not
crazy.
crazy.
Okay, that's good.
And I always say that it really always, even in our media and film, it always depicted that person with
Mhm.
a mental health challenge as being something, such an oddity. So who wants to have that label
Right,
on them
right.
and say, I don't want people to look at me and think that I'm like those
Yeah,
images
yeah.
that we have
Mhm.
seen in movies and TV and magazines about, quote, the crazy person.
Yeah.
So I think that we're tearing it down slowly, slowly, slowly. I mean, you see the commercials now on TV, even here locally with the It's Up to Us campaign,
Mhm.
where they're showing it's everyday families and everyday life, like our everyday
Right,
family
right.
that experienced it, and many others that I've worked with. So and I can tell you, even though it's not just a tagline. When you see it happens to anyone, I have seen very wealthy people, very poor people, black, white, Asian, every
Okay.
community has mental illness
Mhm.
within their within their communities. So it hits everyone, and it can be the same types of challenges can occur. So I think by showing that and letting people know that it is an illness and it is not a character flaw,
Good.
I think that's one of the most important things to help tear down that wall of stigma.
I'd have to agree with that. I might be younger than you, but I do remember commercials with
Mhm.
the insane asylums, like,
Mhm.
and it was black and white. I'm picturing it right now, like black and white.
Mhm.
I think of the padded walls. I remember
Yes.
like certain conversations being had when I was younger, within my family, and they
Mhm.
would call each other crazy and say, "I'm
Yeah.
gonna put you in the room with the padded walls." And
Yes.
I used to be like, what is the padded walls? Like,
Mhm.
and my grandma was like, the place where you can't hurt yourself, you want to act crazy out here, we'll put you in the room,
Mhm.
and so it's like, okay, if I have an outburst or if I am
Mhm.
upset and somebody else perceives it a certain way, they gonna put
Mm-hmm.
me in the room with the padded wall. So
Yeah.
I ain't gonna tell nobody I'm feeling some type of
There
way
you go.
because of that. So
Mm-hmm.
I have also seen a lot of commercials where they are showing families in really nice houses. The grass is
Yes.
green, white picket fences, but there's
They're
some,
running on the beach,
yes,
and and they're saying, "Hey, I'm feeling this way." So they're really showing that it's everyday people. And a lot of times, most times, you can't even tell that a person has
that's
a
right.
mental illness by just looking at them. So
Right.
that just tells you that it's like you can't tell any other illness that a person might have
That's
by
right.
looking at them. So we have to really show that.
I agree. So, Anita, what kind of treatments do you feel work best with for mental health needs?
Well, now that I am not qualified to answer, I
Okay.
would say that the main thing is that a person goes to see a clinical professional.
Okay.
Tell them everything.
Okay.
Tell them what they're feeling. Even if the medication isn't working for them,
Mhm.
they may not like those side effects of the medication. Tell the doctor that, and a lot of times they can make adjustments or try you on another medication. So I think the best treatment is what works for that individual
That's good.
person.
That's good. So
Mm-hmm.
go and get help.
Yes.
That's the first step. And
Mm-hmm.
don't be afraid to let people know that you are feeling different than you have been, or that a loved one has been feeling different than you have been.
Yes.
Um so do you feel individuals can be completely treated for mental health? Do they fully go away? Do you think if someone was diagnosed with a mental illness that that's something that can go away, or is it, does it depend on the mental illness?
Well, I have read, and this is the things that we tell and show people. And again, an individual should talk to a medical professional. But from what I know, many of the illnesses that I read off on that list, they're treatable. And it is different for everyone. It doesn't go away. Recovery does not mean cure.
That's good.
And so, yes, it's just like sometimes with a person diabetes, you can treat that. You can live a healthy life by getting the right treatment and medication for it, but it's still there.
Yeah.
And even sometimes with cancer, some cancers go into remission, but it could be that they could be still there and
Mhm.
could come back at some point in
Okay.
time. So, but with mental illness, from my understanding of those that I read on the list, is that they don't go away, but they
Okay.
are treatable, and a person can have a great quality of life living with any of those conditions.
Okay. That's good information. So for folks in the community who want to know more and help more, what can they do?
I would say I have to, of course, tout the organization that I am still affiliated with and I used to work with for 10 years. I was the education director at NAMI San Diego. And they have, that organization is a grassroots organization designed for family members and individuals to give them education and support.
Okay.
It's not a place you go for clinical services, but they have classes, they have groups, they have all types of information, and they have even a helpline that you can call. It's not staffed 24/7,
Okay.
but you call and you can leave a message, and then someone will call you back with some of the information you may need. But I would have to say that that is an organization that I know because I have I utilized it
Okay.
in my time of need, and
Yeah.
then I got to work there and serve many thousands of other family members and individuals. And I can tell you that it's probably 99% staffed by people with lived experience. They're either a family member like me or an individual like my son,
Mhm.
who is in a place of recovery where they could go there and serve and work with other people affected by mental illness. So NAMI San Diego, it's spelled out www.NAMI San Diego. And as another resource that NAMI San Diego developed, they actually developed 3 apps, and they're called Oscar.
Okay.
And they're called, and I'm gonna, share this with you, and
Mhm.
we'll put this on
All our social
your social
medias. Mhm.
media, but it's called the Organized Support Campaign in an Emergency Situation. That's what the acronym stands
Okay.
for. And it's actually an app that gives you all the county services for before the crisis, during the crisis, and after the crisis. And then they also developed another app for families of children and youth. It's called Oscar Jr. And
Oh,
that gives the same type of information, but for children and youth.
that's
And
good.
then they also did a third app. It's called Alfred EDU, and that one is to help guide families in the education system about IEPs if their child may have be displaying mental health challenges. It helps them with the education system. So those are three free apps actually
That we could
as
download
well.
on our
Yes,
phones or
that you can
tablets, and
download on the phone.
that's good. I didn't know that.
Hmm.
Now that's technology for you.
Yes,
I
yes,
mean,
because you want to reach people in every form. They have a great website, they have the apps, and then they still do those classes and groups are still done. I call it the old fashioned way. I am a facilitator of a support group, and that still old way of people coming, sitting, and being in a safe space
okay.
to talk about what's going on in their lives and their family members. So they do it all three ways,
That's good. That's
Yes,
good. And we needed the resources. Some people just need to know where to go and
yes.
have a comfortable place to be able to access that. I think one of the things that I'm grateful for with the podcast is that I'm able to provide information where people can listen and maybe jot down what they need to. So we will make sure that we post all of this information on all of our social media pages. I'm still working on getting my website up. But it's gonna happen, and
It's
then it's
coming.
gonna come. We're gonna make sure so that people will be able to go somewhere and find out where do I get help, and what does that look like. So thank
Right.
you for that. You said something about um before, when we talked before I was here, you mentioned something, and I have it in quotes here, but I can't really remember. But it was
Mhm.
cultural humility.
Yes, yes.
Tell me about that. Why did I write that down? It's significant for me, but I couldn't remember. And I'm like, I'm just gonna ask her because
Yes.
we transparent. This is a transparent podcast, so tell me about cultural humility. You changed a word.
Yes, it used to be, they call it cultural competency. That's something that a lot of organizations, because again, as you mentioned earlier, even about the African American community and
Mhm.
how we see mental illness, and other communities still sometimes have their self-imposed stigma. And so organizations want to deliver that mental health services to the communities based on how they receive it, how they would want to receive it and be
Okay.
most comfortable with.
Okay.
So they try to train them in quote cultural competency. And I think it's very hard to become quote competent in someone else's
Yes.
culture.
Yes.
But if you use the cultural humility, then that can mean that I understand that they may do this differently and I want to respect that way and try to deliver services based on that. And a lot of time it's just using people from that community
Yes.
to deliver the services. And because we did something similar with a community that we delivered our classes a certain kind of way all
Mhm.
across the
Yeah.
country,
Yeah.
delivered the same way, but we found out that this particular community, they wanted it to be a professional and not a family member. They would receive the material more so from the professional. So we did train the professional in that community
Mhm.
to deliver the same kind of course that we normally have delivered by a family member. So that was us being, humility, excuse me, using cultural humility in order to, to serve that particular
I
community.
like that a lot.
Hmm.
That would make me comfortable. I mean,
Yes.
it's real easy for people to check the boxes.
Yes.
And I think that with respect to mental health, you mentioned the lived experiences.
Hmm.
You can't teach certain things,
Yes.
so a person who has been through it can maybe deliver the information, and another person going through it
Hmm.
receives it better if it's coming from somebody who has already dealt with it.
Yes.
So with the cultural humility, I really like that word,
Hmm.
and I was thinking about it ever since I was over here last. But just remembering how in my depression, I didn't want somebody to clinically tell me what I need to know
Hmm.
so that I can get the help, medically.
Right.
But it was helpful, more helpful for me when I was able to get around people who had dealt with it before.
Yes.
And so, and then I was better able to retain the information and
Mhm.
move in a different way. Not and it's everybody's situation is different, but just knowing
Mhm.
that somebody you can connect with somebody who's been there before for
Yes.
me is was helpful for me. So having those types of programs, or even for you how you go
Mhm.
out and you speak,
Mhm.
to people in their language, so to
Mhm.
speak, so that
Yes.
they can understand it. Oh, okay, so I'm not the first or the last person to go
Mhm.
through this person right here has been through it, and now look how she is,
Mhm.
going out into the communities and helping other people to understand
Mhm.
and where to go to get help for that. So that thank you for that, clearing
Yes.
that up for me, because I had it in quotes and I'm like, I'm just
Mhm.
going to ask her. One last question that I have before I get to the last question that I have.
Mhm.
We talked before about the need
Mhm.
and the gaps.
Yes.
And so I know I had a few notes here about supportive housing and peer
Mhm.
specialists and support with respect to programs. Can you touch on that a little bit? Like what the needs are
Mhm.
for families or individuals
Yeah.
dealing with mental illness?
And because even I still currently work with a lot of families, and I hear this is still, something that I hear very commonly is that the stay for their loved ones when they do get to the hospital in a crisis situation, that normally they're released pretty early. And it's
Okay.
like anyone, oh my gosh, my wound is opened up, but
Mhm.
I'm just going to slap a band aid on
Right,
it.
right.
But maybe I need to be there a few more days for someone to monitor that
Yes.
wound,
Mhm.
a little longer. And I know that's due to lack of the beds in our county. And I'm speaking from our county. I know
Okay.
that I just recently read that the new budget is supposed to increase the number of beds that are
Okay.
available so that people can have a little longer for someone to monitor them during after a crisis. So I still say that is a gap, is
Okay.
the number of beds in inpatient beds.
Mhm.
Also, I know that there needs to be more supportive housing. I know that a lot of individuals live with their families still.
Yeah.
And that is because usually if they don't have a full-time job, or if they only have the Social Security benefits, it's not enough to live on your own, especially these days in this county.
Yes.
But if there were more supportive housing programs where a person could get that sense of independence,
Mhm.
then they could live independently and have their own apartment, maybe even if it's shared 2 bedrooms with another, individual. But giving people that sense of independence, I know, helps them better in their recovery.
Mhm.
But sometimes that can be, a barrier to someone's growth.
Right.
So I know that supportive housing, more beds. I know they're increasing the number of clinicians for like that psychiatric emergency response team.
Mhm.
I know that I sit on the board of the probation chiefs advisory board, and I know that even the probation department is doing more and more where they're staff is a trauma informed, and they're working with the youth more, and
Yeah.
so that they don't end up in
Right.
in adult probation.
Right.
Let's help these kids heal and get through what they're going through as children with
Right.
services, and then they won't become the adults in the probation
Okay.
system.
Okay.
So I know that there is a lot of work being done here in this county to improve, and we just have to keep on giving them the examples
That's
so that
right.
they can continue to work on those gaps.
That's good. I know I have to give a shout out to my where I work at right now,
Mhm.
Father Joe's Villages.
Oh,
It is
yes.
actually I do work in permanent supportive housing
Mhm.
with our clients that deal with dual diagnosis,
Yes.
mental health or substance abuse, alcohol abuse. And I
Mhm.
know that currently Father Joe's is opening up a lot of other properties
Mhm.
with respect to permanent supportive housing.
That is
There's
great.
actually about three that I could think of right now that's opening. They have been working really diligently to restore old hotels and turn
Yes.
them into permanent supportive housing.
Mhm.
And one of the key things with the program that I work with is that it comes with case management.
That is
So
the key.
we have our
Mhm.
clients that live in the buildings. We work in the buildings where our clients live at,
Mhm.
and so we're able to be provide them supportive services with
Mhm.
case management. So, and we have a peer specialist on my team that I supervise. So
Great.
someone who
Mhm.
takes shows them how to go shopping and
Yes.
budget their money, and
Yes.
case managers who are there for them if they need to apply for social security or get an income and things
Yes.
like that.
Mhm.
So I do know that those things are in effect, and it's going to be uh step by step,
Mhm.
things, and people needing to get involved more.
Mhm.
It's unfortunately money is something that we need to be able to do,
Mhm.
to make sure that these things stay available, right?
Yes.
So but I know for a fact that Father Joe's has purchased a few buildings, and they
Oh,
are
that's
it's
wonderful to
coming
hear.
soon here in the summer.
Yeah.
There's at least two buildings in the summer that I know is opening for permanent supportive housing. So with case management services.
That
So
is what that is what I hear most from family members. It's not no, they don't want to just have your, toss their loved one out in the street
right.
in time of need, but they know that they say, I'm not going to be here forever. So to get that person started in independent living,
Yep.
that is going to help them so that if they can not worry about
Yes.
what's going to happen to their loved one, if something happens to them or when they pass on.
Mm-hmm.
So that is wonderful news. And they say, I would love to have a place, but I don't want to just put them in a place where no one is there to help and
Right.
support them.
Right.
We want them to have, as you said, case management
Mm-hmm.
and, some support there to help them to live independently more successfully.
That is good. Okay, so before we end, I have one more question. What is it that you would like to leave us with today? Something,
Hmm.
even if you want to reiterate what we talked about or something different, what else can Anita Fisher give us today that we can take and maybe go back and they can replay this and hear it again and again and again if they need to go on the social media pages and getting the information? Give me something, anything that you would like to share with the listeners here on Pretty Tough Room.
Well, the one thing that is like my personal mantra is that education, education, educate yourself about mental illness.
Mm-hmm.
Because even as you mentioned, I listened to your one of your previous podcasts where you talked about the mental health first aid training. That anyone can attend that training. So even just in general, the public should educate themselves about mental illness, and it will help you understand. And again, that helps erase the stigma. If you or a family member are living with mental health challenges, go to NAMI, take their classes, and we have support groups. All of their services are free of charge. And so that's a way of educating yourself and the individual to help them into their place of recovery. And just never forget that recovery is possible. And again, it's not cure, but it means that finding the proper and right treatment for you as an individual that can help you live that quality life.
That's good. Thank you so much,
Mhm.
Anita. And so you are an independent consultant for mental health, right? You do your
Yes.
own thing out here and you go and you talk to people. Will
Mhm.
you give us the information we need in case someone wants to
Mhm.
contact you to maybe utilize your services?
Yes, I do have a website. It's www.fisher FisherMHconsulting.com, and I have my email address is Anita at FisherMHconsulting.com.
Well, thank you again,
Mhm.
Miss Anita. It was a pleasure to speak with you today. I know I'll be hearing more from you, and you'll be hearing more from me because this, even though May is coming to an end in this mental health month, is something that we should be intentional about every day of our
Yes.
lives for ourselves and our loved ones. And so I
Mhm.
probably will be, checking in and out with you sometime to try to, just reiterate some of the information we have. We're
Mhm.
going to be doing a relaunching of the Pretty Tough Room in the
Ooh.
summer, and I'm
Mhm.
still trying to figure out how I'm going to do that in what ways. And I would love to invite you to come out, maybe do a
Mhm.
little consulting or some type of conference with people in
Mhm.
person. So maybe we can get some people to
Mhm.
ask you questions personally and things like that. So I'm very appreciative of our time we spent together today in this relationship that we are building. Thank you again so very much, and we will definitely be talking with you again soon.
And thank you so much for taking on this topic, and thank you for inviting me to be here.
You're welcome. So thank you guys for joining us today. You go ahead and check out our Facebook, Instagram, and YouTube pages. I'm going to put all the information there that we got from Anita today. If you have any questions or comments or concern, go ahead and just drop them down on the Facebook page or go to the YouTube page and comment. Don't forget to like and subscribe. And remember, tough times never last, but tough people do.